Welcome back to the AM show, and let's get into our big stories for today. And in our big stories for today, we are going to be talking about something that's quite sensitive for all of us, because I can imagine how many of the children out there will be going through the problems that we're going to be addressing. And it's interesting that we're going to be doing that discussion with someone who's so proud of having decided that he will live his life promoting the welfare of children. And he loves Ghana as well. His name is quite intriguing, but you would love it. Now, more than 40% of children born in the eastern region of Ghana do not have childbirth registration, according to the UNICEF data on birth registration for 2024. And I bet that it's only eastern region, and that when you go to western region, when you go through central, you probably find the same thing happening there. Now, what is accounting for this phenomenon, and what is the risk for not validating the identities of these children in that region? We'll look for answers today. And to help us do this is, okay, let me leave it to Sweetie. I guess that she's very drawn to the name of this gentleman we're going to be speaking to.
Shame on you, Kojo. But our guest today in the studio with us is Osama Makawi Hogali. Did I get it right?
Correct. Very well.
Welcome aboard.
Thank you so much.
Yes,
thank you so much for having me.
Okay.
Right. And you are the country representative of UNICEF to Ghana.
Okay.
And you have been in this position for 2 years. June last 2023 to now. And so I know when I ask you what UNICEF is, you have so much to say, because you have been with this particular fund, not just the UN, UNICEF, for decades, to put it succinctly. But I want to find out, or I want to start the conversation with the angle of how close do you think you are to achieving your goals? What are they? And you can situate it in the Ghana context. What is UNICEF doing, and how close are you to actually achieving those goals?
Thank you very much, first of all, of having me today. And indeed, I'm very proud to be spending almost entire my life or my career to be working for children, because this is a mission and not a job. So we have a mission. I would like to answer your question by saying, how far did we come from the day I joined? And where are we today? The world have come a very long way. 3 decades ago, children in schools are much more fewer than today. Children who have been able to receive their vaccination are absolutely were a fraction of the society. And today we have the majority, and we're talking about those whom we have not been able to reach. So we are there. And we have seen that the child mortality reduced dramatically, child morbidity also reduced dramatically. Commitment to child rights, it's increasing. Having said that, it does not mean that we are not seeing new challenges that are coming for children. I guess today the world is not a safer place in terms of the conflicts we see children suffer from. And children are impacted, and often that are forgotten in the climate change and the impact that happened to them. That conversation is not happening enough around the world to see what happens to these children. So I would say I'm very happy of what we've done, but the road is still long, and there is more need to be done, and these challenges are changing as we progress in our lives. In Ghana, Ghana has done very well. You have come a long way, and I think I always tell the children and the young people that I meet that they have to be very proud that they are Ghanaians. Having personally being an African, I'm so proud of Ghana as well. We look up to you, and Ghana have come in a very amazing journey where you've been.
Okay.
Has more to be done? Yes, there is more to be done.
What are the basic challenges of confronting children? You mentioned earlier that you've been to all the part of the northern part of the country.
Correct.
What do you see to be the basic challenges confronting children of this country, even though you say we've done better?
The main challenge is the access the equal access to essential services, education, health, protection, as well as simple things as base registration, as we've been talking about. I think there are big gaps. The government produces what they call the district league table. Yeah. And in that table, you can see the disparities that are happening between the regions and the districts, and we're seeing those wide. I think the aim here is to close those disparities and to look into strategies and planning system or approaches that would reach the most difficult to reach children. I think we're talking about vulnerability and leave no one behind. Who is that one is left behind? That's the question we need to ask.
And do we know the factors causing those challenges? Because when you know, then you can be able to deal with them.
One factor I am absolutely getting more convinced about, that the one-size national planning fits all, it doesn't reach them. Neither the one-way budgeting. We need to have a deliberate specifically addressing the hard-to-reach areas because the context is different, the challenges are different, and they need a different approach to reach them. I think that's a national dialogue need to happen, and I hope that Ghana would carry on having that differentiated planning, if you like, in order to be able to reach to everyone in Ghana.
You mentioned hard-to-reach areas.
Correct.
Recently, you went to the Afram Plains, right?
Correct.
What was so, because that's also one of the areas that we consider hard to reach.
Correct.
What was so special about that particular trip for you to have been there yourself?
Why did I choose to go there? I chose to go there because I went through the statistics and I was reviewing, in particular, the birth registration performance in the country. And it actually strikes me that, as you said at the beginning, almost more than 40% of the children and in that region are not registered, are not captured, are not counted. And I wanted to understand why. What happens? Why is in that region? And I was told initially that the terrain is very difficult, the access is very difficult. And I said, I want to go and see how difficult it is. And it's not easy, but they're reachable. I was there, so we can reach. If I can reach, everybody can reach. So that is the point I want to make. I want to make these people, there are ways to reach them. That's what I'm talking about the differentiated planning and the differentiated effort to provide the services where they are.
There must be something about the data that made you wonder or triggered you to figure out why these children are not registered, which will speak to the significance of registering birth.
Correct.
So educate us on why it's absolutely necessary that every child that is born in this country is registered, and then we can follow your thought plan on this. Yeah.
When the child is not registered, the child is not counted, right?
Yeah.
When we talk about how many children we have been able to bring into education and how many are yet to be brought into education, keep in mind, those who are not being registered are not part of those not counted. So the base of our planning is wrong. The child is not registered, almost they do not exist. So they are invisible. So I think it's very important, and it's a very important human right that child is, number one, having the identity and to be registered as a human being in there. I have seen it in many countries, what the impact that can happen. It's not only to the child, but I can tell you, it can be a public health threat. I have seen outbreaks in countries where we had an argument with governments where I worked before. Why do we have an outbreak while our vaccination coverage is so high? And we found out that these outbreaks are on the children who are not registered, who are not part of the denominators of the vaccination. So, and we got polio outbreak, despite the huge figure of coverage that we do. So coverage is about those who have been registered, and coverage miss those who are not registered. And that's how important it is.
Go ahead, Coach.
But recently, when it comes to the birth and registration of kids, we heard of the shortage of the papers that were to be using, even given the birth certificates to these children. It's intriguing.
Yes.
Can you confirm that, or do you have information that that probably is one of the reasons why they are not able to register these children? And what sort of support is UNICEF giving in that regard?
I think let's not minimize the problem on the absence of the papers. I think the problem is multifaceted.
Okay.
But let me say, beginning by, I always say, birth registration is a low-hanging fruit. We can do it, and we can do it very quickly. It's just need us to look deeper and looking into the issue and looking into the system. Secondly, I strongly believe, after I came from there, that perhaps we would like to look back and review of the births and deaths registration systems. Is it the best system we can do today? Because the system is expecting a multi-sectoral collaboration from the health sector and the education sector. There is a lot need to be done. But is it the best way to actually reach out to those? Many problems. For example, staff. I have been to districts where the birth and death registration staff is only one person. One lady I met. And the budget is quarterly, and it's too small to actually be able to do anything. So I think we need to dig deeper, and I am sure that there are a lot of solutions and low-hanging fruit that can be done. I am absolutely confident Ghana can do it. And because where you are today, it does not commiserate with the percentage of birth registration coverage. Your other indicators by far ahead, and I think this is a low-hanging fruit for Ghana.
Once you identify it as a low-hanging fruit and that there is a lot we can do, is there a proposal from UNICEF as to how we can go about it?
Yes, there are several proposals. I think I am calling for the whole stakeholders to come together and review the system itself. I think we can learn from other country experiences on how we can simplify the registration, the birth registration system in Ghana, and that is something that we can do. I don't want to come with a prescriptive effort, but my call here is that we need to give it a bit of the attention that it requires, and I am sure, 100% sure, we will come up with a very doable solution into these areas and a more efficient way to carry out the registration systems.
Let's talk about the MBET registration system, which I think was rolled out in 2016 or so.
Right.
That's like the mobile registration system.
Correct.
Where every child can have access to be registered and all. Do you think that it is not, it doesn't hold the key to our quest to register all births, especially in the rural areas? And if so, what are the gaps so we can begin to close those gaps? Because I think it's an initiative that could actually solve the problem, because then you don't have to go to a central place, an institution somewhere before you get to register your child.
Indeed.
So what are the gaps there?
Indeed, there are a number of gaps. Number one, the hard-to-reach areas, we don't have enough staff to reach them. So I've just talked about one staff for a whole district. You can imagine how much that staff can do. Second, that staff budget is too low. It's too low. What I have been told, it's a 500 cedis quarterly. So that need to be reviewed to be able to carry out the job.
500 Ghana cedis per quarter.
Per quarter. That's what they receive. That's what they have received. They receive.
Tragic.
So it's too low. Second, I think we need to look into how we can build on the existing access that at least the health system has, and the education system has. Because for the time being, we know that the health system should inform the birth registration, and they claim that they do. And they send it there, but there are no certificate comes back from there. And that we need to strengthen that collaboration with them. The education system is supposed to be an informant. If they identify a child without a birth certificate in school, they should inform the birth registration, and it's not working, and it's not happening. And often the teachers and even the health workers at the CHIP compound, they do not know that this is actually what they're supposed to be doing. So there is a lot of work need to be done in that area, and I think it's still doable, and it's still something Ghana can
Let me stay on this for a tad bit longer. I was reading, in preparing for this conversation, that this challenge is tied to the number of Ghanaians who prefer to have their children at home rather than go to the hospital. Because, if you go to the hospital, it's automatic. And it's also, drawing on the increasing number of, was it increasing? Yeah, increasing number of, not increasing, the number of uneducated women we have who would deliver a baby because that's how it's been done. Don't forget, we are coming from a deeply cultural setting. As Ghanaians, we used to love, or we adored women who, when delivered by themselves, they say you're a strong woman, the gods are pleased with you. How do we begin to reorient that mentality? Because then if you understand the advantages you get having your child delivered in a hospital, some of these problems would be solved. So I think we can discuss this without touching on the people who choose to have their children at home, because that's the best they know. So where do we begin to reorient that mentality, that whether or not you want to have your child at home, have a healthcare professional there? I don't know what the solution is, but you are the expert, so let's talk about it.
I think, number one, we would like to have every child delivered under a medical care. I think this is what Ghana is inspiring for, and that's what you are working on. And we make sure that safe delivery is important.
Safe delivery.
As 2 days ago, I was attending the launch of the VNR report by His Excellency the President.
Okay.
And one of the very striking statistics came into that report, I think the report is public now, is about the stagnation on the progress on the maternal mortality in Ghana. We still have over 300 maternal deaths for every 100,000 live births, and that is too high, right?
Yeah.
And for that reason, we must improve the safe delivery under trained health professionals. I think that is a core objective, and it can't go in isolation. If we achieve that, then we automatically are able to have a much more increased number of children that are being registered. But nevertheless, even though that who are delivered at home, we're talking about communities like the one I've seen. Everybody knows everyone.
Yeah.
Even that health worker in the CHIP compound, despite the fact that there are very few, only one, what I've seen in these places I visited, that person can still be, with the collaboration with the chiefs, with the local community, they can still register this children.
Okay.
They know who delivers and who the new baby in their communities. So ways are there, collaboration is there. That's why I'm saying it's a low-hanging fruit. You can do it.
Okay.
But let's still stay in the Afram Plains.
Correct.
Aside the birth registration, what other key observations did you make with regards to children in those areas?
A number of them. I think the major challenge is the access to services, as I said. It's not only the birth registration, but it's also to the health. I have seen the CHIP compounds, which, by the way, built by the communities themselves. Okay. I have seen schools, and schools are also built by the communities themselves. And the one that I just left in Bombata was they are building, finishing up their first police station. So,
when you say built by themselves, you mean the community people themselves?
By the community.
Wow.
By the community. Yet, having said that, the number of staffing is very,
It's a challenge.
is a challenge. There are villages, they don't have a midwife at all. And there are villages that they have only one nurse is there. I have asked about the essential drugs and treatments are there. And to be honest, I haven't come across a major gap in the chip compound that they said we have. Because simply, it's very interesting, because they have the zip line. Okay. And the zip line are able to deliver to this. So we use technology for that. But the problem is, in this chip compound, there are no equipment. I have seen a midwife who will squat in order to deliver a woman, because simply there is no delivery bed. Oh. I have seen that they lack equipment like the gross monitoring equipment and others. So the question here for me when I came back from these places is more of an equipping the chip compound than just the drugs, which I really appreciate that they have the minimum drug lists that are there. Education is another one. There are no GHS in many of the places. I have seen children who walk up to 15 kilometers every day in and out. And obviously, these are the ones that they will drop out. And guess, when they drop out, what do? They work.
Yeah.
Yeah. So these are challenges, and the number of staffing. I like the incentive that the government is really putting in sense that to have those professionals to work in these very hard to reach areas. But I think that we need, in terms of the implementation, we need to strengthen it much more. I have seen in the health system, they have a system on which that and a promotion can be faster if you go to very hard areas. I think we need to look into that. There must be a good incentive for these people to go and live and serve in very hardship areas. And I understand that also now the Ministry of Education is coming with the 20% salary incentive for those who are accepting. I hope that would also make a big difference in that. But we need to look into differentiated planning into this.
Let's talk about collaboration. In terms of the Ghana Health Service, the Ministry of Health, are you collaborating with any of these ministries or agencies to ensure that we scale up the impact of the work you're doing here? To begin to change the narrative in terms of how many children actually we can help.
Yeah, I as UNICEF is a United Nations Children Fund, and Ghana is a very proud member and respected member of the United Nations.
You said that twice now.
I do. I feel very privileged that I am in Ghana.
Okay.
Yeah, and what we do and our job is basically to support the national system to be able to deliver the services and the progress that they aim for the inspiration of the country. And Ghana has the right inspiration, and I think it's going in the right direction. There are always going to be an area of or adjustments as we go, because the context also change and the world around us is changing very much. The point I'm making here, among all of these huge priorities in front of us, we in Africa, we need to understand our real capital is in our demography and our young people, because that's where we stand out from the rest of the world.
Yeah.
We are a young society. Yeah. And this young society is an asset if we take care of them today. And we absolutely need to guide that for a future leadership if we want to go ahead. So it's an investment. Wherever you put in children is an investment. And we're talking about development. Development is always about future dividend. And who is your future? You need to invest today for that dividend in the future. Children must be central, because priorities are really competing nowadays. And I want everybody to be a voice of a child, including you.
Yeah, which is why I was trying to see if we have any active partnerships or collaborations.
With the government?
Yeah.
Oh, yes, indeed. Everything we do is through the government and the ministries.
Okay.
So we implement in health, we support the Ministry of Health and the Ghana Health Services, also in education, and we have great partnership with the Ghanaian institutions, and we're so proud of that.
Okay.
In terms of what you saw there, what is your expectation or in terms of how quick you want the situation changed, for those places?
How quick I want? There is a difference between what I want. I want it to change today.
Okay.
But I am going to spare no effort in order to carry this message back to with me here in Accra for the decision makers and propose some solutions on the table. One thing I would like to really look at, for example, access to education and having schools. We can't have a school in every village because we don't have the critical mass for students. But let's not forget, we live in this world today. Technology has provided a complete new definition for what access means. So can't we have a dialogue between the academia and the technology innovators and look into what can be a new model of delivering education? So that model, which is a generic one for everywhere, perhaps it's not the best solutions, but I would like to have our academia, and we're going to work with that. The University of Cape Coast, they're really good in that. And also we would like to look into the private sector who would be looking at the technologies that could be actually used in order to help with continuing at least the learners, our young learners continue their education. So in a reasonable way.
There are many people who are watching us today who have the resources and the will to do something positive for children, but they probably don't know how or where to start because these are private individuals who, probably just sitting and twiddling their thumbs because government has not come to them to say, hey, bring your resources into some sort of pool so we can go to the eastern region or the other regions and save the children. What would be your message to such people who have the means and the will to help?
My first message to these people, number one, I will thank them for their generosity because I know that the Ghanaian are very generous in terms of the goodwill that they would like to help others. Number one, that's number one. But the question here comes that I would like them to ask themselves, are we going to continue to provide charity or we would like to provide empowerment, right? Because if you provide somebody a meal, you can also provide that someone a fishing net. Then with that fishing net, you have fed that person for the rest of their life rather than a one meal. I think we need to ask about what is this contribution collectively. And I can tell you, this contribution collectively, if it's put in the right direction for the public good, it's going to make a big difference. The life today have changed, and the expectation of the role of the private sector, they need to play that role, and I think it's an ethical question. And when I talk about children, do not forget, these are children of the staff of that private sector too, right? This is their own children.
Right.
Yeah.
Their staff, these are their children.
Yeah.
And these are the facts.
Well, and I guess that if you're an organization out there and you're listening, these words should move you to keep doing the things you do. If you haven't started, this is time for you to start to help people in hard-to-reach communities. Because look, we've made it such that even reading and writing is a huge problem for some of these kids.
Correct.
You won't imagine JHS, 3 pupils who cannot really construct words correctly because of these challenges. Access to educational materials has been a challenge, So I think this call is something that we all have to pursue.
Absolutely.
But you've worked in this country for 2 years.
Correct.
what will you describe as the, what excites you about your job here? And what is that key thing you've done that you are proud of within the 2 years that you spent here?
I must say, when the Ghana Post appeared, I had to beg to come. I wanted to come to Ghana.
Oh, okay.
And I really wanted to I expressed strong interest in coming to Ghana, to my headquarters.
What about Ghana?
Interested. Why Ghana? You need to know. Ghana, number one, is the first country on earth who have ratified the Convention on the Right of the Child.
Okay.
Many people don't know. You should be very proud. To me, personally, that what we call it, the Convention of the Right of the Child, was born here in Accra. Sure. That is, you need to know, and you should take pride of that. Second reason is that as an African, I've seen Ghana, and we always looked into the trajectory of your progress and your development, and I was very impressed. I'm an economist and a development worker, and I've been looking at what's happening in my continent. Ghana, you stood out. You stood out on your journey.
Okay.
And I wanted to see that myself. The third point in coming to Ghana, I just wanted to be part of that success story between the combination of a development trajectory, but also the child rights commitment. And I must say, what motivates me since I landed in Ghana as a representative, my job is basically to advocate, to convince people on child rights, right?
Yeah.
I don't have to do that in Ghana. It's a question, there is no lack of commitment for child rights in Ghana. What is there, my conversation, is the affordability to implement all these child rights and every child get their right. So I don't have to convince someone in Ghana to say, children have right for education. That's absolutely not a question in Ghana, do you? No. Isn't it? Nobody debate that. But how can we make sure that every child have an opportunity to learn? So that is the conversation. So for me in Ghana, that is an inspiring, and I'm really happy to see. And that's where I see that Ghana can absolutely lead, as it always does. And I always say, Ghana, you are a trendsetter. You have set the trend for the world to follow on the CRC, on the Convention on the Right of the Child. But you are also a trendsetter for all of us here in Africa. We look up to you. So for me, if Ghana can't do it, I think Africa would be less enthusiastic and to go. So we have that commitment for the whole continent development and changing the face and lead by example in Ghana. So that inspires me.
Okay.
Yeah.
Suti, this is more like when you have something, you don't appreciate it, but someone somewhere appreciate what you do have. I mean, a lot of us in Ghana, look, even when you speak to people today, they say, oh, we have given up on Ghana. But this is inspiring.
Yes.
To hear that apparently we are like the torch bearers for a lot of these African countries in a lot of things that we do. It's quite good to hear. But despite the fact that you paint this very beautiful picture about Ghana, you definitely see some of these challenges.
Yes, there are.
You've told us a lot. So how do you still stay strong in the face of all of these challenges as a representative?
Because I am absolutely confident that in Ghana you can do it. I worked with all the Ghanaians, whether they are in the senior or the lower level, and I looked into the mindset in Ghana. And I think for me, development is a mindset. We can do it. We can do it. We often talk about asking for additional resources. But for me, efficiency on spending is a resource mobilization strategy. It unveils you more resources. So we really need to look into how do we spend, where do we put our priority setting, and how our expenditure goes. In that, missed opportunity on resources, on inefficiencies, might be more than what we can actually mobilize. I don't know, but let's try it. And I am quite confident that our challenges in Ghana, that the solutions are there. The second one, and I'm doing it with the Joy News actually, or with you, that our communities, I have seen it in the central region. I think that I don't want to spoil what's going to come up because there is a documentary being built up for that. I have went to the central region and I went to the villages, and I have seen challenges in particular related to the early pregnancies and also to the work of children absenteeism from schools because they work with their parents in the farms and so forth. I have seen some communities found a solution for this. That story by the communities themselves need to come out because other communities can learn how to do it too. Okay. So a lot of these challenges are actually, the solution exists within the communities.
Please, pray tell, what are some of the solutions? What did they do? What did they come
But I am going to spoil your documentary that is being prepared.
He mentioned that there's a documentary coming.
So you can tease us and not necessarily spoil it. Okay.
Yeah, but it is in that, and there is a beautiful story coming up, and I think you are building on that, and I think that's the right thing even the media should do.
Okay.
Bring us those stories. That knowledge for horizontal sharing is so important to contribute for development. Not every problem needs a massive resources. There are problems that we can solve them by learning from each other. And I want that community examples to come up, but also by being there, you will be the voice of these communities who are seldomly reached.
Okay, so he still didn't give us the solution anyway, but we'll wait for
I think that was a part of your question that I wanted to get an answer in terms of what you're most proud of since you've been here 2 years now.
In Ghana.
What are you most proud of? What is the one thing that you have done or you led, an initiative, a program, something that the results just is one to die for? What's that thing for you?
Let me get the very new one. I am so proud about the introduction of the new vaccines. That's a couple of weeks ago.
Okay.
I think the HPV vaccine is one of the proud stories that we have come up. The list is long, to be very honest, since we have come. The whole issue around the focus around the foundational learning is another excellent initiatives, and it's expanding. I am so proud about the ISS, that the integrated social service approach, which is a really innovative approach of having all ministries working together and reaching out to help the children who are in need. I am proud about the progress that is happening around the LEAP, despite the fact that I know there is a lot need to be done. And by the way, when I went to these villages, I haven't seen anyone registered in the LEAP in there. So these are the most, so that's one of the things that the gaps we need to cover. But there is a huge, progress in that. And the commitment to children, I think that's the most important part. Keep up that. Okay.
Thank you for coming. Yeah. And I think we have a minute for your final words. There is a central message, I believe. If you don't remember anything from the conversation at all, what is that one you want our viewers to remember and take away from this conversation? And you can look right into your camera.
Yeah. I think the key message is I would like to make sure that the national planning and budgeting system need to be revisited in order to reach every community, especially the hard to reach and those are live in those islands. The second message I would like to have, I think we need to have a stakeholder dialogue around the access to services, whether it's in health, LEAP, education, and others. But I think a national dialogue is required in order to really look into how are we accessing and the service delivery in the very hard-to-reach areas. That's, I think, an important message for them. Look at your staffing at the very difficult places in health, in teachers. We don't have enough of them. Not to speak about the social workers themselves. So in those, take advantage of technology and redefine what access means.
You know, there was in the course of the conversation, I said something about how we are cultural people as Ghanaians. And I want to put you on the spot here. Often we find ourselves at the intersection between what's legally and morally correct and acceptable globally and what we come from, what our way of life was, culture, traditions. So I think a year or so ago, there was a child who was betrothed to a chief or a chief priestess of a sort. She was at school-going age.
Right.
And it became a controversial topic as to, well, it's chieftaincy. That's what we do. We betroth young women to big old men, you know, so that they can become wives when they grow out of age. And then the issue about, you know, disciplining children, like caning children in school, which has also become a topical one. I know that we've removed corporal punishments from our school system, but that system where when a child, instead of positive reinforcements, we just cane the child, you know, maybe it's just quicker.
I know.
What is the posturing of UNICEF on these matters when there's an intersection between what's culturally accepted by a people, for example, the caning, the betrothing young children to be wives when they grow up, and all these outmoded cultural practices, and what globally the world is shifting towards? Where do you draw the line?
There is no line to be drawn. You know, we all love our children, don't we?
We do.
Right? We all have the goodwill for our children. And so do UNICEF. When we say, do not hit your child, for a reason. Because now the science have really come out and told us what happened to that child brain when you hit that child, the neurons and the damage you make in the brain. So there is a reason. I think the question here is about that we don't differ, but I don't think that the engagement with the traditional leaders or with the religious leaders, wherever that we have a gap in understanding, is enough. I think that dialogue need to be really much more deliberate in the sense that to explain why do we say that. And I can tell you, we will all agree, because the fundamental issue here among all of us, we would like to have the best for our children. And that's where we agree. And explain back and forth and have dialogue. So let's have that dialogue in a much more sustained and deliberate manner. And I would like to have that dialogue to really be a Ghanaian dialogue. Let's have our scientists talk to our traditional leaders and to educate. It's a question of gap of knowledge, and I think that's what it is.
Okay. Well, that's it. It's a gap of knowledge. Yeah. If we knew better, we'd do better.
Yes,
that's what you're saying.
Exactly.
Yeah. Well, thank you so much. So this is the country representative to Ghana, UNICEF representative to Ghana, Osama Makawi Rugali. And it's been a pleasurable conversation. Thank you for joining us on the AM show.
Thank you very much for having me.
Okay. When we return from the break, we'll tell you more on the AM show. Please stay. We'll be right back.
Thank you.